Welcome to our city, and here's what's happening this week around our city. On Wednesday, July 27th at 5 p.m., Mayor Boards will join the Greater Elizabeth Chamber of Commerce at their Summer in the City After Hours Networking for an evening of mingling with fellow business professionals. For more information, please call 908-355-7600. On Sunday, July 31st at 12 noon, Mayor Boards will attend the 8th Annual Columbian Festival. This event, hosted by the Morris Avenue Midtown Business Association, will feature food, music, rides for the children, and much more. We'll discuss this event much more later on, as we'll have some of the representatives on as guests. If you need more information concerning this or any other events this week, please call the Public Information Office at 908-820-4124. Joining me from Trinitas Hospital is Dr. Lisa Henson, Chair of Radiation Oncology at Trinitas. Welcome.
Thank you.
And also Dr. Barry Levinson, Medical Director of Trinitas Comprehensive Cancer City. Welcome to you both.
Thank you very much.
And I understand you have a great sense of humor.
Well, it's, you know, sometimes people always ask, isn't being an oncologist a very depressing kind of thing? And certainly there are many, many serious moments in oncology, but you know, I think it's important to be able to interact with patients. Also, humor is a very uplifting thing and often helps people to get through the difficult times.
Well, take some of that energy and excitement that you have and share with us about the dramatic new treatment that's available at Trinitas Hospital.
Well, we have a new type of radiation technology, and that's called AccuBoost. And I'm going to let Dr. Henson, my colleague, talk about it because she's the Chief of Radiation Oncology.
Okay.
Thank you. So AccuBoost is another example of a cutting-edge technology available at Trinitas Comprehensive Cancer Center. The AccuBoost does exactly that. It provides a boost of radiation therapy to the breast. And we know that an extra boost of radiation therapy for cancer patients with breast cancer improves their outcome and decreases the chance of the cancer coming back. So we're really proud of this new technology that we have.
Now, the AccuBoost, is that different from any other treatment?
It is. It uses real-time mammography, so when the patient comes for their treatment, we actually perform a mammogram and identify exactly where the cancer was, and then provide high-dose rate brachytherapy to the breast. So this is very new technology and really conforms the radiation to where the breast cancer was while sparing the normal tissues, the normal breast tissue, the normal ribs, lung, and even the normal heart tissues behind the breast.
Okay. Now, Dr. Henson, who are some of the best candidates for this treatment?
Well, breast cancer patients who are undergoing breast conservation therapy, so women who are not having a mastectomy, are really candidates for radiation therapy in general. And then we'll evaluate them to see if they're a candidate for the AccuBoost. Typically women with early stage breast cancer, but all women really should be evaluated.
Now, this is not the first time that Trinitas has been the first in having some type of new technology. In the past, what are some of the others first for Trinitas?
Well, we were the first in New Jersey to deliver rapid arc radiation therapy for the treatment of prostate cancer patients. So now we're the first in New Jersey to deliver the AccuBoost radiation therapy.
Now, what makes AccuBoost better for those particular patients that we mentioned?
Well, historically, high-dose rate brachytherapy was delivered through needles. So actually, there were catheters that would pierce the breast, multiple catheters. So this new brachytherapy is done non-invasively. We use surface applicators, so the radiation goes through the skin without any invasion of the breast tissue, so there's no pain involved. So it's non-invasive technology, and we can focus the radiation, and we're using image guidance. That's really the key in identifying where the cancer was, and are we targeting the radiation exactly to where the tumor was.
Now, from a patient's point of view, how long do the individual treatments take, and how long is this type of therapy?
The radiation therapy is about 15 to 20 minutes a patient can expect, but they're in a seated, comfortable position, and it can take anywhere between, I would say, 15 to 20 minutes, and it's the boost phase of radiation, so that's about 5 to 7 days of radiation therapy.
And how does AccuBoost improve the ability of doctors to treat patients?
Well, this is the first time we're really looking at the breast tissue with mammography. The surgeons can leave me clips inside the breast tissue so I can know exactly where the breast cancer was. So we're merging technology in imaging with technology in radiation therapy together to offer the best treatment.
If I may add, and I really appreciate what Dr. Henson is saying, providing all the details about the AccuBoost. It's important to keep in mind that one of the goals we have in oncology therapy, both in radiation oncology and also medical oncology, is to find newer treatments that are more effective and less toxic, have fewer side effects, because we all know that treatments for cancer can be difficult to endure, so that if we find more specific therapies that are more effective and less toxic, we have better outcomes and happier patients.
Now, I was reading not too long ago with the Star Ledger about the first taking place at Trinitas. Who do we give credit to? And I mean, what's the success? How's so much success happening over at Trinitas?
Well, I think it's a team approach that we take at Trinitas. So having the surgeons speak with the medical oncologists, speak with the radiation oncologists, I think that's really the key in successful treatment. Really tailoring therapy to the patient's individual diagnosis and your individual cancer. That's really the success rate, excuse me, comes in looking at the big picture, because every patient's different, every cancer is different, and you really need a good team approach.
I think it's very important. The hospital, the goal of the hospital, of the Trinitas Regional Medical Center and of the Trinitas Comprehensive Cancer Center, is to provide the best care possible for patients who for our patients, many of whom are right here from Elizabeth. And we want to make sure that even though we're a community-based hospital, that we do not stint in any way on excellence of care, which means providing all the latest technologies available. So this is an example, I think, of the commitment of the hospital and the cancer center to provide the best care possible for the people in this region.
Now, the AccuBoost, does it improve the ability of the doctors to treat patients?
Well, for me, I can say it's the first time really that I can actually see the breast tissue. Before, we would use clinical examination where we think the breast cancer was, or where the surgeon removed the tumor and left maybe a scar in the breast. That's where the targeted boost radiation would be delivered. Now I can use a mammography, see the entire breast, and see the actual site of where the surgery was. So this is very new for me. The radiation therapy techniques have been around for a long time, but we're constantly improving them and merging them with better visualization and better image-guided therapy with the radiation therapy, and really to provide patients the best possible treatment.
Now, as you look and see different things, is the patient allowed to look also, or no?
The patient can see. Sometimes they're in a slightly altered position during the treatment. And they do look, and it does give them comfort that I'm looking right before their therapies and outlining exactly where the radiation should go. So some patients like to look, some patients don't like to look, but it's better if I'm the patient, I would want my doctor to know where my tumor was.
It's true that very often when we offer to show patients their tumors or their x-rays or CAT scans, I think a lot of patients really are interested and like to see, because, so to speak, a picture is worth 1,000 words, but there's certainly patients who are somewhat turned off by that, and so we certainly don't force anybody to look at anything they don't want to see. So I think the majority of patients are interested, and I think seeing the tumor actually helps patients better understand their condition, but by the same token, we respect sometimes people are just too anxious about it.
Okay. Now, for our viewers who may not be aware, what makes the Trinitas Comprehensive Cancer Center a full-service cancer care facility?
Well, I'd like to answer that question being the medical director. There are many fine attributes we have at Trinitas Comprehensive Cancer Center. As I said before, it's a real challenge to provide excellence of cancer care in a community-based setting. And I think we do that very, very well at Trinitas Comprehensive Cancer Center. First of all, we have radiation oncology and medical oncology in the same facility, and we even have surgical oncologists come and attend at the cancer center as well. We have a combined modality thoracic oncology program for lung cancer patients and other patients with cancers of the chest, where we have the surgeon available, the medical oncologist, and the radiation oncologist all together to see the patient at the same time. So, and we provide, by having the doctors communicate with each other directly, really makes a difference, I believe, in cancer care. As treatments become more complex, cancers become, the treatments we have for cancer become more diverse and complex, it's more important for the various doctors who are involved in the patient's care to really come together and review so that we can have individualized patient care. And we have that at the Cancer Center, not only through our combined modality clinics, but also through tumor boards. We have a weekly tumor board where we discuss cases amongst ourselves. We have radiation oncology, medical oncology, surgery, surgical oncology. We have the pathologists who show the material, the biopsy slides. We have the radiologist who reviews the films. And then we sit down together, look at each individual case that's presented, and discuss in detail how best to treat the patients.
Now, how long have you been with the Trinitas facility?
I've been at Trinitas now for 2 years.
Okay.
I had come from, previously I was on the faculty at UT Southwestern Medical School in Dallas for many years, but the opportunity to come back east and be the medical director at Trinitas was a very, very inviting proposition for me. When I came and saw not only the commitment that the facility has to excellent care, but also the staff, I think, is marvelous, and people are really caring, and I do believe our patients feel very well cared for.
Okay. And how long have you been with Trinitas?
4 years.
Okay. Have either one of you met a guy named Zabowski?
Yes. Very good physician.
He's an excellent physician.
You sure now?
I can assure you he's an excellent physician. In fact, he's my physician.
Okay. Yeah. And he's also my physician, so I'm just making sure I'm in good hands there. Now, what makes all of that so important for patients and their care and treatment?
I'm sorry, what was the question?
What makes all of that so important for patients in their care and treatment that we've discussed so far?
I would say, like Dr. Levinson mentioned, it's important for a patient to feel comfortable and to trust their doctors. And I feel that when patients do come to the Comprehensive Cancer Center, from the time they walk into the door and they're greeted by our concierge, from the time they meet our nursing staff, our nutritionist, we also have art therapists, music therapy. They really do feel like they're well cared for. They're in a place that they feel comfortable. They trust their doctors. I think that's one of the most important things when you're getting a long course of treatment. Radiation therapy can be up to 8 weeks. So you want to make sure and feel comfortable that you trust your patients, your families trust the doctors. The patients trust their doctors, the families feel comfortable sending their family members to us. I think that's really what we're most proud of. Okay.
Now, if our viewers would like to know more about the Caboose and the Trinitas Comprehensive Cancer Center, how can they get more information?
Oh, feel free to call us at Trinitas Comprehensive Cancer Center. I don't know which phone number we should give.
Well, they certainly can call me. I'm Dr. Barry Levinson. I'm the medical director, and my number is 908-994-8772. We also have a website, which is www.trinitascancercenter.org.
Okay. Thank you. Wish you two the best and much continued success, and thank you for stopping by today.
Thank you very much for inviting us to come.
Thank you for having us.
We'll be back with the second half of Our City after these words. Thank you.